Welcome back to Med School Mind Maps. Today I want to talk about Guillain-Barre syndrome. But before we get to Guillain-Barre syndrome, I want to review the neuron and a couple components of it. We have a picture of a neuron here. Here's a cell body, and extending from the cell body is the axon and attaches to other neurons around here. This is where the synaptic cleft would be. And wrapping around the axon is myelin, which are these ovals here in white. And what makes myelin is something called a Schwann cell. So this myelin allows electrolytes to skip the space in between them and allowing the axon to propagate much faster. So now let's take a journey over here to Guillain-Barre syndrome and the autoimmune or disorders here. Now, the etiologies of Guillain-Barre syndrome are a couple. We have an upper respiratory infection, which is usually the most common. A common bacterial infection is Campylobacter jejunum, which usually presents with bloody diarrhea, and then we have vaccination. So the pathophysiology of Guillain-Barre is a host immune response. So your immune system, so typically your B cells, your T cells, will actually cross-react with peripheral myelin, which is made by Schwann cells, and this is what causes axonal damage, not allowing those electrical currents to propagate as fast as they need to. It presents with flaccid ascending weakness. So this is very important to remember. Guillain-Barre syndrome starts at the legs and slowly goes up your body. And it will occur with sensory symptoms, maybe some dysautonomia, so respiratory failure, which is usually the cause of death, heart problems, and digestion problems. So this is later on in the disease course as it extends all the way up to your thoracic cavity. And then we have severe respiratory muscle weakness, again, was cause of death. Most patients are put on ventilation. And to work this up, we want to take a lumbar puncture. And in a lumbar puncture, we're going to see increased protein with normal white blood cells. So this is very important because a lumbar puncture is also how you'll diagnose bacterial meningitis, viral meningitis, encephalitis. And normally, you're going to see white blood cells if you have an infection, but this is post-infection, so you're going to see increased protein-only normal white blood cells, and this is called albumocytologic dissociation. To treat this, we're going to have to give IV immunoglobulins and or plasma exchange. So we're going to have to take the immunoglobulins out of circulation through IVIG and through a plasma exchange. So that's Guillain-Barre syndrome, everybody. Hope you enjoyed, and see you next time.